All right, hello everybody, and welcome to NP Table Talk. It's Eladia Lala Reyes, NP.
Christy Alman, DNP.
Margie Rodriguez, NP.
All right, so we have been again listening to what our people want to hear and kind of hear what we're talking about and what kind of advice we have. And the big topic, honestly, has been anxiety and depression. And that affects so many people, right? Young and old. And so we thought that's a great subject to actually start our day off with. For me, I was talking about how I recognize that in the primary care world. You should be screened at least once annually when you go and see your primary care provider. We do PHQ-9s and GAD-7, one which evaluates anxiety and the other one that evaluates depression. Does it definitively say you have anxiety or depression? No, it's a tool that we utilize. And I know for me, I use it as a tool to say, hey, these numbers are kind of high. How are you feeling? How are you sleeping? Do you feel depressed? Are you feeling anxious? And I'll tell you, within 2 seconds, if someone has these issues, they're crying. They're telling me, hey, you know what, Mrs. Reyes, I really struggle with X, Y, and Z. And then that at least starts off that conversation, because a lot of people don't want to go in and tell a complete stranger their problems, right? Like, I'm great. I'm doing good. I'm the mom of the household. I keep it all together. And then when you open up that door, sometimes that conversation is easier to approach, that I am struggling. And I know we've had other shows in the past talking about even healthcare providers struggle with this, with COVID and the loss of patients and different things that we've discussed in the past on other podcasts, of course. But that was definitely a big subject, and it's patients struggle with it all the time. How does that affect people in the inpatient world, Christy?
So same, like I've currently, or not currently, but just recently a patient admitted for whatever it is, right? And then they are tearful to the nurse, and then the nurse is like, hey, did she tell you this? I'm like, no, she didn't. But because they tell the people they felt most comfortable with. So then when I went back in the room, I asked them, like, is this an issue? Are you feeling, kind of depressed or anxious? Like, it's just so, and then it's like the floodgates open, and then and it also, that kind of stuff manifests itself, in different patients, different ways. So sometimes they might be coming to you for, oh, I'm feeling fatigued, I'm feeling this, I'm feeling that.
I can't sleep.
When really, like, maybe it's not necessarily like insomnia. They don't need a sleeping pill. Maybe they just need, help with their anxiety or things like that. So it's something that, in all
walks of life, like really you are addressed, whether it's work-life balance, whether it's stress at work, stress with kids, stress with anything of the above, which we all deal with. But everybody copes with things differently, and having that avenue to talk to your provider is essential. Chronic pain for you, Margie, right?
Absolutely.
For you. I
mean, depression is something that we see quite often, especially those with chronic pain. They're taking medications. I've had this pain all my life, and they get tearful. I mean, that definitely can be a cause of anxiety and depression. Just not having their pain managed.
Yeah, I can't play with my grandkids. I can't play with my kids. I mean, it affects that kind of happiness. And of course, they're not going to go in saying that, but it's again doing the due diligence of screening your patient appropriately, having that conversation. Which medications are good for you? I know with my young population, sometimes they do those. I shouldn't even say the young population, because even the elder people that I know is those monster drinks, the caffeine drinks. Oh. Yeah, they'll be drinking them, and they're like, I don't know why I'm anxious, and I'm like, but that's the nicotine, and that's the caffeine, and you talk to your smokers about these things, this smoking is not calming you down, it's actually amping you up more. Caffeine drinks, if you're drinking 1 to 2 of those a day, that's also making you feel overdrive, and then you know what happens when that caffeine's out of your system? You crash. Exactly. And then my poor patient's like, yes. But again, screening and talking to your patient and figuring out these simple things. And you know what? you know what? I stopped drinking the caffeine drinks. I feel so much better. I'm glad, but they don't realize sometimes that crash of caffeine that they just had is related to that. They think that there's other things going on. And so, again, being mindful and screening and asking these different questions is really eye opening for a lot of different patients. Smoking, right? Like, how many people go and say, I'm so worked up or I'm very stressed, and they go smoke, and they don't realize that that's contributing as well. Not just that. Have y'all seen what it costs to smoke like these days? I mean,
expensive.
It's super expensive.
For a pack. The name brand pack is $10.
Oh, wow.
That's insane. Like, see, that alone to me gives me anxiety. But
you know what I think might be worse is all these vaping things.
oh, that's
Oh,
all.
yeah.
So we don't
my
know,
goodness.
like we know what happens after you smoke. Right now, there's a Surgeon General warning. that you see, but all these vaping things, I don't think there's warnings with those. But no, in 10, 20 years, when it's been around and it's their kids being affected, that's when we'll find out.
Yeah, well, there's
Yes.
popcorn lung already because of it. I mean, there's different issues already occurring, and I always tell my patients, you know what a product that is naturally grown occurs through your body. What happens, right? We know lung cancer occurs because of it. When you're vaping from these utensils, you're inhaling these products, and who knows what microscopically it's affecting you. And like you said, 10, 20, 30 years, what are we going to see? We don't know. And that's why it's so mind boggling to me.
And the addiction
The
rates,
addiction of it,
the
yeah.
addiction
Yes,
rates
yes.
are high.
So that definitely contributes. So again, screening your patients for the anxiety and depression aspect of things is always important. Of course, when you talk about different medications that we treat with them, what's the number one drug of choice, guys? The SSRIs, right? SSRIs. We always say, hey, these are the SSRIs. It's the black box warning. Homicidal, suicidal ideation, which usually scares patients. And so I'm very diligent in telling my patients, when you pick it up from the pharmacy, they're going to say this because it's a black box warning. Make sure that you teach your patients that, because some patients will hear that and they don't want to take the medicine. It's usually higher in adolescents, those things, of course, but having that door open and having the patient mindful, if they do have the suicidal, homicidal ideation, they go seek healthcare provider. That's essential.
And just don't abruptly stop your medication. That's the other thing.
Yes.
You never, especially the longer you've been on it, do not stop it abruptly. Please do seek healthcare, providers. Help before you stop, because it's
you want to
actually
titrate
not
down.
safe.
You want to titrate
safe.
down. You want to make sure that you get off of the medicines appropriately and not suddenly. Very good advice. Other things to consider, if they have a low appetite, what kind of SSRI, what depression medicine, mirtazapine, Remeron is another one that will stimulate the appetite. Thank you. Sorry, I lost that word. But it'll stimulate the appetite for those people that have a low appetite. And then for those patients who have issues with overeating, a good choice is bupropion, and bupropion also helps with smoking cessation. So if you have a double whammy, that's one medicine you can give them both, right? Those are just little pearls of wisdom for those saying, how do you choose medications? Is again patient specific. Sertraline's a good one. But yeah, it's always taking those things in consideration when you're talking about those medicines.
Sure.
There's also those uncontrolled substances, right? That we use for anxiety. There's also the non-controlled hydroxyzine, right? So talking about them. We also talked about non-pharmacological things, in conjunction with SSRIs, it's psychotherapy.
Exercise.
Yeah.
Again.
Sunlight, hobbies.
And psychotherapy.
Yoga, meditation. There's just different non-pharmacological things that you could do. Sometimes it's just setting yourself away from the
stressors.
Exactly. Step away from there. Go take deep breaths. Come back. Regroup. Even music. Music is another way to de-stress.
So
I think we all have different ways of de-stressing, and it's just how do you de-stress? For me, I listen to audiobooks quite a bit. Sometimes medicine, but audiobooks, and then my mind is in a book. It's not thinking about the stress that I had today, like, oh, I do need to do this, I need to do that. So that's just one of my ways I I de-stress. Yeah, Margie?
I like to de-stress. One is listening to music. I love Zumba. So I love to dance.
She's a Zumba queen, like for real.
So that's one way. And then like you, I listen to podcasts, but I like the Christian podcasts.
Yeah, good.
And you?
I do kayaking. I do a lot of fishing, and I
Nice.
do audio books as well. If you know me, my mind's always going, so those things always help me have that in the background, and I'm always learning in the process. So yeah, it calms me down for sure. But everybody, as you can see, uses different avenues to relax, and whatever makes you happy. And like you said, identifying it, saying, hey, this is what makes me upset. I know this is a trigger. I'm going to step away. I'm going to take those deep breaths or count to 10, you know what I mean? Depending on what it is. And I know something we always say is just avoid stressors. Well, the stressor is my life, so it's easier said than done sometimes. But those deep breaths and the counting to tens and realizing that this is my trigger and I need to step away is always helpful in those situations. College students, I'm sure they struggle a lot. And NP students, did y'all struggle with stress?
Oh God, yes, it was constant.
And so it's, again, being mindful of those situations, saying I need to step away. And again, talking about it, counseling is always really good with medication in conjunction.
Yes.
And so if you seek counseling, they give you the proper tools, or again, they help you identify this is what I need to do when this is occurring, and why you're coping with certain things a certain way. And so I do recommend that to patients as well. Again, always talk to your provider regarding your health care, especially your mental health, because it is essential to your well-being. And I know even in the holidays, people experience different things, right? Because it's family stress, financial stuff, right? On top of it, plus work, and always being mindful you're checking on your friends or even your jobs. And people have high stress jobs, right?
I heard the other day, like high stress, high stress, high reward. Yeah, low stress, low reward. But
yeah, I think we all live in a high
Yeah.
stress world, so you're right. But we also see people go to Panama, so
And
and that's a big
so-
stress reliever for
I
us.
forgot about that. But a good
Well,
thing
that makes you happy.
is I did meet, right? So I'm waiting to go on this tour with this indigenous tribe, and I see these medical supplies. I'm like, what is all that, right? So I go over there, and they're like, oh yeah. I'm like, oh, what are y'all doing here? She said, oh, well, we have a free clinic that she started, and it's actually called the Wellness Foundation, I believe. I will put it on Facebook. But this RN from West Virginia actually started this, and she not only goes to Panama. There are 7 different tribes of that indigenous village. She does, I think, like 4 or 5 of those, but then she also goes to places in Mexico. And so if you're interested, the next actually Panama trip is in September. And so I'm looking forward to volunteering.
Very good.
And right now there are no doctors, no nurse practitioners, no PAs on that specific thing. They don't have anyone.
Really?
Yeah, they're
So
it's
how often
nurses.
does she go?
She tries to go twice a year.
Oh, okay.
Each place
Yeah.
twice a year.
That's
Yeah.
cool.
And they do like A1Cs, blood pressures, weights.
So screening things for the
major screening.
That's awesome. That's good.
So what about medications?
So she actually has an agreement with it's a national company, or no, national actually organization that approved what medications she can take and they can't be expired. Might be the World Health Organization.
Okay.
I'll look that up. I should know it, but I wasn't planning on talking about
No,
it.
but that's what's so good about having conversations
How would
sometimes.
an NP benefit from being? How would they help in that area of work?
Helping with the screening process, it sounds like.
I mean,
with
I've
the
got
screening? Okay.
years. I mean, and it's great to be an RN, but when you're a nurse practitioner, you've got
A different
a
perception.
very different perspective.
Mhm.
You're able to more diagnose. Right? This is what we
Right.
do. We're not kind of, as registered nurses, we were always, just listening to what we're told and this, but now, and I know we've all talked about this before, is you see somebody and you're just diagnosing.
Oh, you're already
them.
diagnosing them right.
Yeah.
So
Sounds
it's a
right.
different mindset. being an NP. So she was, very
That's
looking
good.
That
forward
is very
to-
nice.
That is very nice. And sometimes so travel led you to actually help more people or want to help more people,
Yeah.
which is awesome. And that's one of, I know Christy's stress relievers is that
That
travel
is,
aspect.
See, and I can work over there.
That'd
be okay.
That would be fine. That would be fine.
But to do like another 5 days in the hospital, no.
Yeah. But that's what's so good about going and doing what you love and then finding different opportunities where we can help our communities and even abroad. And that's wonderful, So find your thing that makes you feel good and helps with your anxiety that you may be having or stress, and find your stress reliever, I should say, right? Not
Yeah.
necessarily anxiety. I think we all struggle with different things. But if you do have anxiety or depression, please seek out your provider so that they can help navigate that for you. Again, we're not pill pushers. Sometimes it's just helping you get to that right person to talk to and get that help that you need, because we don't want you to struggle alone. That's it,
Yeah,
right? I mean, that's it. At this point, I think this was a great conversation, ladies.
Very good.
All right. Well,
And if you have any more questions, if you need help in finding support, please email us. You can send us a message on Facebook as well. But that's a private way to send us a message. If not, follow us on NP Table Talk, YouTube, Spotify,
podcasters.
Facebook, I think, but it's all NP Table Talk. So,
Yes.
And then if you have questions or suggestions for a future show, then please let us know. But we do have our April speaker booked, and
Stay
should I
tuned.
say, should I say what it is?
I think keeping it secret is kind of nice.
Okay.
I think it's kind of nice.
But
Stay
This person
tuned
has been a physician for probably like 40 years.
for a very long time.
Maybe not 40, but
Yeah, he'll have plenty to talk
it
about.
will be a great podcast. That you
And
will
he's a
not
great
wanna miss.
speaker. He's a great speaker
Yes.
too.
Stay
Yes.
tuned.
Yeah.
All right, we'll see y'all soon.
Thank
Thank
you.
you.